Hello everyone, my name is Amanda and I am an occupational therapy student at the American Stroke Foundation. This video is a follow-up to my previous video, which covered how to make your own therapy putty at home. Now that you've made your therapy putty, this video will show you some ways you can use it to help stretch out and strengthen the muscles in your hands and fingers. Since the majority of survivors of stroke have one side that is affected more than the other, the focus of this video will be on helping the affected hand. Because of this, each exercise will only be demonstrated on one hand. You are, of course, welcome to perform any of the exercises on both hands if you feel they would be beneficial. Lastly, since increased flexion in the hand and arm is common among many survivors of stroke, these exercises will focus primarily on extension, or opening up the joints in your fingers and hand to help combat your increased flexion. You will want to make sure you wash your hands before using the putty. You will also want to work on a clean, flat surface. Since the putty itself cannot be cleaned or sanitized, washing your hands and using a clean surface helps ensure the putty will last longer. Before we get started with the therapy putty, let's get some of those joints warmed up first. Use your unaffected hand as needed to help with these movements. If your joints are particularly tight, be sure to go slow, and when you reach as far as you can go, hold the stretch for several seconds before slowly returning to the starting position. Place your affected hand palm up on a flat surface, and let's start by getting your thumb moving. First, while keeping your thumb parallel to the table, pull it away from your hand as if you are making an L with your thumb and index finger. Next, move your thumb across your hand and touch it to the base of your pinky, or as far as you can go. Then, as you move your thumb back across your hand, keep going until you end up with your thumb making the same L as with the previous exercise. Finally, with your hand still palm up on the table, gently bend and straighten your fingers, making sure to extend them as far as you can, and hold them in that position, using the table and your unaffected hand to help with this. Now that we're all warmed up, the first exercise with the putty is called finger scissors. You will only need about half of the putty for this exercise, so start by dividing it in half. Put one of the halves aside and form a ball with the other half. Place the ball between your index and your middle fingers just above where the two fingers meet. Then, squeeze the putty with those two fingers, as if they are scissors trying to cut the putty. Your other hand can help if needed, but try to do as much as you can with just those two fingers before letting your other hand assist. Reshape the putty into a ball and repeat the process between your middle and ring fingers. Reshape the putty into a ball and repeat the process between your ring and pinky fingers. Reshape the putty into a ball one more time to do this exercise with your thumb and index finger as well. The next three exercises will require you to make a snake out of your putty first. To make a snake, roll the putty back and forth between your hand and the table. Try to keep your fingers straight and roll back and forth to the end of your fingers each time. You can also use both hands to roll the snake, with your unaffected hand helping to keep your fingers extended on your affected hand. This can be a good opportunity for weight bearing on your affected arm as well, if it is safe for you to do so. The next exercise is called two-finger spread. You'll need to roll a snake and then break it into several smaller pieces. Wrap one of those pieces around your index and middle fingers. Once the putty is secure, spread your fingers apart as far as you can. Repeat with your middle and ring fingers. You can assist with your other hand if needed, but do as much as you can unassisted first. Repeat with your ring and pinky fingers. The next exercise is called full finger spread. You'll need to roll a snake using at least half of the putty or more, depending on how large your hand is. Place all of your fingertips together and wrap the putty in a ring around them. Then, spread your fingers outward, resisting the putty as you do so. Repeat several times. The next exercise is called finger extension. You'll need to roll a snake and then break it into several smaller pieces. Wrap one of those smaller pieces around the tip of your index finger and grab the ends of the putty with your other hand. Bend your index finger towards your palm, and with your other hand still holding onto the ends of the putty, pin them to the palm of your hand. With the putty secure, extend your finger as far as you can. Repeat this process with each finger. Depending on how easy or difficult this exercise is for you, you can increase or decrease the resistance of the putty by adjusting the thickness of the pieces you use. The thicker the piece, the more difficult the exercise will be. The next exercise is called 3-finger pinch and pull, which uses all of the putty molded into a thick cylinder. Hold the putty in one hand in the same way you'd hold an ice cream cone. Not too tight, but not too loose. With the other hand, use your thumb, index, and middle fingers to pinch around the cylinder, then tug the putty outward. Reshape the putty and repeat several times. This last exercise is called Meatballs and Pancakes. The amount you use will depend on how big your hands are. In this video, I am using about half of the putty. Flatten the putty between the palms of your hands, making the pancake. Then, in just one hand, your affected hand if possible, roll the pancake back into a ball, or the meatball. Now, flatten the putty into the pancake again. And just as before, using only one hand, form the meatball. Repeat several times. Please remember that some of these hand exercises are much harder than others, and it might take a while and a lot of practice to be able to do all of them. So, this is a reminder to be patient with yourself as you work on improving the use of your affected hand. Thank you for watching this video about exercises you can do with your therapy putty. I hope that you find some of them helpful. Here are my references in case you would like to learn more.